The sharp tools, bright lights, and x-ray machines. There are a lot of things that even I'm 31 and I just get freaked out. I get nervous when I go to the dentist.
I know. Our resident dentist, though, here on TCL says getting kids into the dentist chair early can actually help them avoid major anxiety down the road. So to find out more, I went to Shamblott Family Dentistry in Hopkins, and I brought a very special little friend. All right, Dr. Shamblott, we're talking kids and getting to the dentist. So before they get into your office, what are some things that parents can do at home to get their kids ready to come to see you?
They should talk about how it's fun, it's good, it's healthy, the dentist is your friend. That's a little mirror. Who's that? Is that Stella? Even if the parent or both parents have dental phobia or really don't like coming to the dental office, they should do their very best to keep that to themselves and shield their kids from that, because it's very easy for a parent to pass their phobia on to a little one. Yeah, that's for you.
Dr. Shamblott says he likes to see kids in his office for the first time between the ages of 1 and 2, or within 6 months of their first tooth coming in.
You see Mommy in the mirror?
It's perfect timing for my friend Stella to take a seat on Mom's lap, of course, here in the dentist chair.
Like an alligator? You go big like an alligator?
Stella is the 16-month-old daughter of TCL executive producer Mandy Toddick. So what kind of things do you do here to make it fun for kids?
Well, we like to start nice and easy.
That means rides up and down in the chair.
Oh, we're going way back.
Checking out Dr. Shamblott's cool light-up glasses.
They have a flashlight on them. Isn't that cool?
And handing over a bright toothbrush for Stella to take home.
We try and make it a light, happy, fun atmosphere so that the kids want to come back.
Stella wasn't exactly up for a full exam, but Dr. Shamblott says that's typical for kids her age. Stella did a great job, but you didn't get so far into looking at her teeth. Would you consider that a failure or still a success?
Oh, I consider that a major success.
Dr. Shamblott says these first visits are all about getting kids comfortable and establishing good habits at home.
The more these habits become ingrained at younger ages and solidified as they get older, the greater the chance they'll stay with them the rest of their life.
So Dr. Shamblott says today's visit went well. What about Miss Stella? Stella, did you get a sucker? Yes, we like the sucker. Stella, did you get a toy? Yes, she got a toy. I think this visit to the dentist was a success, don't you? Do we know how to brush? Brush, brush, brush. Good girl!
That's good. You got it in there.
That was so sweet. Okay, so a few notes for parents from Dr. Shamblott, and these are important to remember. This one I actually found kind of surprising. Dr. Shamblott recommends no toothpaste before the age of 2. He said he's not a fan of those toothpastes that are made for infants. He says they don't really do very much. You should really just brush with water, and then maybe as you try to work towards getting your child to gently floss, he says those baby teeth actually have quite a bit of space in between them. So flossing is pretty easy, so you can just kind of get them used to that and get them in the habit. Okay, the worst thing you can do for your child's oral health, you guys,
here we go,
is to send them to bed with a bottle of juice, pop, or even milk. He says this is terrible. It can result in so many problems. If you send your child to bed with a bottle, that's fine. Just make sure there's only water in it. It has to only have water, because anything else will just start to sit on those teeth. It will cause so much decay, and then you can have major problems that will lead to actually having to have an operation later on, because the dental work can't be done on little kids can't hold their mouths open forever like we can.
Right.
So they have a hard time with that.
So it would turn into a very big deal for them.
Right.
Wait, I would have thought milk was okay.
No, only water. Only water. And then a little note on that little lollipop that Stella had. That's actually made with xylitol, which is a sweetener that Dr. Shamblott says isn't bad for your teeth. So, you know, when you go to the dentist, you'll get one of those to take home with you.
And you've got skin in the game. With your little Bernie, she's going to start popping teeth out soon.
Oh, she is going to stay Mama's little tiny baby forever.
Oh, that's adorable. Thanks to Shamblott Family Dentistry for sponsoring Twin Cities Live. They're located in Hopkins, and their contact info is on our website, twincitieslive.com.
And big thanks to Stella.
Stella, did she not do a great job or what?
Does.
How good was that? Hey, still to come, New York Times.